Assalamu alaikum. My name is Dr. Huda Haider. We will continue with the structures that we discussed before. In previous lectures, we have discussed about the uterus, vagina, and the cervix. And in today's lecture, we will discuss the fallopian tube, ovaries, and the blood supply and lymphatic drainage of the pelvic organs. It is very important. I will tell you the MCQs which are important, and mostly they come into the question paper. First of all, starting with the fallopian tubes. The fallopian tubes, it has four parts. One is interstitium, other is isthmus, third one is called ampullary region, and the fourth one is called infundibulum or the femoral end. Interstitium, as shown in the diagram, it lies within the wall of the uterus. Isthmus, it is the most narrowest part of the fallopian tube, and the third is the ampullary region. It is the widest and the longest part of the fallopian tube. It is very important MCQ. It comes in IMM, that what is the widest and the longest part of the fallopian tube, and it is the region where the fertilization occurs. Fourth one is the infundibulum. It has the finger-like projections in it, and whenever the ova is released from the ovary, it is taken up by the femoral end, and it goes up into the fallopian tube by the ciliated columnar cells. And the function of the cilia in fallopian tube is that it produces current to move the fluid towards the uterus. Regarding the histology of fallopian tubes, it has two types of cells. One are the ciliated columnar cells, other are the secretory cells. The secretory cells, they contribute to the volume of fallopian tubular fluid. Next, most important, you all must know that what are the age changes that occur in the pelvic organs. We will discuss the age changes in the uterus, cervix, and the ovaries. At birth, it is very important MCQ. It comes in IMM that at birth, due to decreased estrogen, the length of the uterus is reduced. It is reduced to 1/3 and the weight by 1/2. And in childhood, the diameter at 2 years of age is 2.5 centimeters, and at 10 years of age it is 3.5 centimeters. And at puberty, its length is increased, thickness is increased, and width is increased. That is 7.5 centimeters, 3 centimeters, and 5 centimeters. I have always also mentioned it in my previous lecture, and its clinical implication. The regarding cervix, it is at childhood, it is twice the length of the uterus. It is very important MCQ, and it comes in IMM many times. In childhood, the length of the cervix is more than the uterus, and in puberty, its length is 2.5 to 3 centimeters. And in childhood, the size of the ovary is 1.5 centimeters, and at puberty, due to effect of estrogen, and its length, width, and thickness all is increased.